Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern. And this is our end of the year show. This is our end of the year episode. We're going to just go over some of the topics that we went over this year. Like, for instance, talking to your pharmacist. We had an episode about that, about how important it is to talk and ask questions of your pharmacist and don't just take what they give you, correct?
Yeah, I think it's terribly important. The good news is that there are several healthcare professionals who can give you information. Certainly your doctor, certainly a pharmacist. If you're in a hospital, certainly nurses can help you as well. The important thing is use your pharmacist as a healthcare professional, not just should I take this one tablet 3 times a day, but use them as a healthcare professional. They can practice at the top of their license. Mm-hmm. They can give you information, what you should know, what you should look out for, and more importantly, ideas. What kind of medications can I get that perhaps cost less? What medications do exactly the same thing? Mm-hmm. What kind of generics are available, or lower cost brands or generics in the same category. So use them and make sure that you're not just using them as someone who's dispensing drugs, but someone who's a drug professional, a drug expert, so that they can help you with your questions.
Right. And of course, pharmacists have the same knowledge, or not the same knowledge, but sometimes even more knowledge than most doctors, right?
Well, certainly about drugs.
I'm putting them in a tough spot.
Thank you. Yeah. Yes, you are. Certainly about drugs and therapy. Mm-hmm. The most important thing is pharmacists are not just dispensing a medication. They are experts in the area. Take advantage of that.
Right. And moving on, we also talked about influenza and prevention with regards to influenza. And you want to go over a couple?
Yeah, we've said this over and over, but I think it's terribly important.
We actually had a couple episodes on it.
We did.
And it's very important.
And travel medicine as well, and what we did. And they all effectively were giving us the same message. And
thank you, Dr. Mark Wahlberg, for your help.
Thank you. And Dr. Barry Pascal for us. The main message that we all have is it's easier to prevent a disease than to have to treat it.
Yes.
If we can prevent problems, we are much better off. It costs less, it takes less resources, the person feels better, you have a better activity of daily living, etc. Mm-hmm. So anything that you can do that prevents disease is the most important thing. And vaccines, as a matter of therapy, are our most important prevention mechanism to make sure that we don't get communicable diseases that could easily be stopped.
Right, and it's not just with influenza. And prevention in any regard, in regards to healthcare, is oftentimes cheaper than the actual trying to what word am I trying to look for?
Well,
to treat.
Yeah, to treat.
Trying to treat.
Just because someone treats doesn't mean that you've done the best thing. If you could prevent it, it's significantly better than if you had to treat it.
Right.
So consider that, and any method of prevention is significantly better than any treatment. That's what we have to remember.
And the reason I was going that route is because we also had an episode about how medications just keep getting more expensive. We talked about that earlier this year. And you want to comment on a couple of those things?
Well, people tend to think that, okay, I have a prescribed medication, therefore that's the thing I need. Mm-hmm. And therefore, whatever the price is, I'm going to have to accept it or complain about it or otherwise. In reality, there's over 135,000 different drugs, dosage forms, and strengths that are on the market today. Mm-hmm. That's a huge amount. And within any given category, all drugs that do the same thing have the same pharmacologic categories, information. It's important that you ask your doctor, you ask the pharmacist, is this something that it's only one and there's no alternative? Or are there other alternatives that are generic, that maybe do the same thing and are much cheaper? Brands in the same category that are much cheaper that you can do. And more importantly than that, don't just accept the fact I have a prescription and there's nothing I can do about it. Go and find out what your options are, and then at least you know, I've tried, I've come up with it. Any of the issues historically of the generic isn't as good as the brand and all of that other kind of nonsense. We live in a world today where these drugs are being made by major manufacturers. They have lines that deal with brands, they have lines that deal with generics. We need to pay attention to that. There are ways to cut down on cost. It doesn't go to zero, but certainly to cut down on cost. Find out, is there a cheaper generic? Is there a cheaper brand? Do they do the same thing, and can I save some money?
Yeah, and even scarier is the fact that when we talked about that episode, when we talked on that episode, we talked about how some drugs cost about the same as a down payment for a house.
Yeah.
Like,
Yeah.
I'm talking $10,000 to even $20,000.
Yeah. And, today we're very lucky in the fact that there are newer drugs and new therapies that begin to cure things that couldn't have been cured before.
Right.
And if there's only one drug in the category, then clearly that's something that we have to address. But typically, if one drug is in the category, the manufacturers are making multiple other drugs. And those multiple other drugs are available. There's cost competition. There's competition over the value of each of these drugs. And so today, usually there are options. If it's new and it's breakthrough, clearly there's going to be a problem. But after it's been out for a couple of years, there's comparisons and options, and those are the ones that we need to pay attention to in order to save costs.
And we also talked about diabetes, and I've heard it called an epidemic. The rate of people being diagnosed with diabetes is going up, and I believe it's still going up. Correct me if
It is. The problem here is type 1 diabetes is usually in kids, something where they have a problem with their pancreas and being able to produce insulin. It's type 2 diabetes that's increasing, and it's increasing because people are gaining weight, they're more sedentary. It is what's known as a microvascular disease. It's in the small blood vessels. It's like cardiovascular disease, they're very related. And so, pardon me, and so it's important that people realize that on one level, losing weight, eating a good diet, watching your activity is terribly important. It's also important to realize that diabetes is something that requires an active, very involved oversight to make sure that the complications don't get worse. Because the complications are not trivial, because it's microvascular and deals with small blood vessels. It deals with the eyes, the kidneys, the heart. This is a major problem that occurs in many organs, and you need to pay attention to it. Is it preventable? Maybe not, because of history of family. However, losing weight, diet, exercise, watching specifically what you're eating, cutting down on sugars, those are critical.
And of course, checking up with your doctor.
Checking up with your
Going
doctor.
to get a checkup every year.
Absolutely.
Crucial.
Checking out with your pharmacist, checking about the drugs that are available. These are all critical.
Right. And moving on from one scary thing to another, we also talked about mental health. And mental health was a big topic, I think, this year, more than others, or at least in the last couple years, where people in the spotlight have struggling with addiction, and mainly because of their mental health, or as they documented, because of their mental health. You want to share a few words, because there's it's heavy in the news right now.
It's very heavy. Yeah. I think in two ways, mental health is getting a bad rap. The people are associating it with people who go out and do horrific things, killing people. It's being associated with poor habits. But the reality of it is that mental health is just as big a problem as it is with physical medicine and physical health considerations. People need to think about it that way. It was kind of taboo when I was growing up. Today it's something that people have to be aware of. There are treatments for it. But most importantly, there are people, psychiatrists, psychologists, social workers, who are available in order to help. You cannot ignore this. You need to make sure that your mental health is taken care of. There are relationships between mental health and physical disease. People who have heart attacks are frequently depressed, or depression oftentimes has associations with particular diseases. These need to be treated, they need to be addressed. Drugs are not necessarily the panacea. Certainly, behavioral therapy is important. Either way, you need to be treated.
Panacea, can you define that for us?
Pardon me. Panacea is the solution, and in this particular case, people tend to think, well, there's a drug for depression, there's a drug for psychosis, schizophrenia, a drug for anxiety, and the reality of it is that yes, these help people who have serious disease, but more importantly, they need to have appropriate behavioral therapy, sometimes cognitive behavioral therapy, in order to ensure that these things are controlled. Drugs are not the solution. They're not the only solution. They treat a percentage of people. They don't treat others. It's terribly important that we don't use them as a crutch, but getting help and getting care is the solution.
This is a pharmacist telling you that drugs are not the solution. That's a pretty big deal.
Not the only solution.
Right. And but also with mental health, you mentioned that back in the day it used to be taboo when people used to tell you just suck it up or pull up your bootstraps, go to work. And well, if we started looking at it that way, would it give people a different mindset?
Well, I think it would. I mean, different cultures, certainly first generation cultures who came, they had taboos about talking about mental health issues. And I think it's important for all of us to realize that while historically different generations of people have thought differently about this, today it's real. It can very easily be due to our environment and people that are around us, but you can't get help by just assuming that you're going to suck it up and you're going to deal with it.
Right.
In most cases, you need help, and there are people to help you today, and those are the people that you need to address. Drugs are terribly important for people who have severe mental illness, but getting it, using it as a crutch for people who have much less severe mental illness, they have to have more than just drugs. There's more here to try and help these people.
Right. Once again, just keep in contact with your doctor, talk to them, talk to a therapist. Talking it out seems to help a lot of people. It's not going to help everyone, but it helps a lot of people.
Yes.
And also on that note, talking to your doctor, we talked about coordination of care as well. Some people talk to the doctor, some people talk to 3 different doctors. Can you explain how complicated that could make things?
The problem with coordination of care has become even bigger today, because you go to your primary care physician, or hopefully you have a primary care physician, and then you may go to your cardiologist, your gastroenterologist, your nephrologist. What happens is each one of them is not necessarily working in tandem.
Right.
Their cardiologist is doing their work, but they're not talking to anybody else. Gastroenterologist is doing it. What's absolutely necessary is that you have a key family practice or internal medicine doctor who's talking to everybody. There is one group, one individual or team that is looking at everything that's happening, so your care is coordinated. Why does it matter? One doctor can be doing one thing, another doctor can be doing another. They may conflict. There may be issues where this doctor is doing one thing and isn't aware that the other doctor is doing something else. As a result of that, not only do things conflict, but they may do things that make another situation worse. And certainly with drugs, when people are on more than 5 drugs, the chances of drug-induced disease, duplication, polypharmacy, which means you're on a lot of drugs and you get consequential problems, all of those magnifying. You need to make sure that there is somebody at the center who knows what's going on and is coordinating everybody to how they're working.
Right. And it could be potentially fatal if you're not keeping an eye on this, or if you don't have a primary care physician that's looking over your entire portfolio.
Yes, absolutely.
Yeah. And that's really. I just wanted to talk over some of the episodes that we had went over this year, and as you can see, a lot of very important topics, a lot of very very hard topics to talk through because the damage can be fatal or it's often preventable. So we also want to make sure that we talk about healthcare topics that are big in the news right now with healthcare insurance and things like that. But we didn't want to get political.
Let me get one important message.
Right.
Everybody should have a list of their medications that they're on. Keep it with them all the time.
Right.
So that anybody who's evaluating them, whether it's their doctor, an emergency room, or doctors in different specialties, knows about all the drugs that you're on. Try and use one pharmacy so that there's one profile with all of the different drugs there, and use your pharmacist to help you to review that, find the best options, remove duplication of therapy, try and help you with any adverse effects, and finding cheaper options. Keep a list of your drugs. It's terribly important.
Yes, and as we mentioned in that episode too, that there are apps that'll help you keep track of it and even remind you of when to take the drug. And so it is. There's help around. There's help. You can find it in here, and we'll put a link down below for GoodRx. So we're not sponsored by them or anything like that. We're not promoting one thing over another. It's just free stuff that you can get on the internet and be provided to you. GoodRx helps you find the lowest cost drug in your area and in the lowest cost pharmacy. All right?
Yes.
And then in most app stores, Google, I think it's Android, right? Google's Android, I believe. And then Apple, they all have apps that are there designed to help you keep track of your drugs and when to take them and remind you of those things. And anything else you'd like to add?
No. Happy New Year to everybody. Have a happy and a healthy New Year, and hopefully peaceful for everyone.
Yes, hopefully peaceful. Well, my New Year won't be peaceful though. Have a happy New Year, everybody, and I remind you to go to ProPharmaConsultants.com. There you'll find Dr. Stern and all his articles that he has written over the, how many years has it been now?
Long time.
Long time?
Yeah. I'm very young though. So
yes, of course, yes. Anyways, that's it for this year, and we'll be back next year, and we'll see you then.